Hey, welcome to EMS Office Hours. This is Jim Hoffman. These are your Monday Minutes. Guys, today we are going to get into part 3 of respiratory emergencies and talking about obstructed airway diseases. And this is sort of a bigger section, so it's going to kind of be broken down into smaller parts even further. And this is going to be part 1. Before I get too much into this, of course, I always like to ask and answer that question, why this stuff is important. And while it's great for exams and for studying for your exams and getting those key elements that you need to pass and succeed on your tests, it's not just for your exams, right? It's great key information that's going to help build your knowledge base. It's going to make you a better clinician out there in the field, allow you to make better decisions, write better reports, and interact better with other healthcare professionals. So it's great for exams, but there's much more involved with that. And this is the important factor when you're looking at these quick Monday minutes. So today, like I said, we're going to talk about obstructed airway diseases, and pretty much that includes your asthma, right? And which is affected about 9 million people, and that's the hypersensitive airways, right, for asthma. And then our COPD, which is broken down to two segments, and usually it's emphysema or that chronic bronchitis, right? And a lot of contributing factors to this, and we're going to get into that in a little bit. But I do want to kind of break down the contributing factors first, okay? And you're talking about things like stress, infection, exercise, of course, smoking, tobacco use, right? Allergens, and that can be food, it can be animal dander, dust, mold, or even pollen, okay? And also some occupational hazards, latex allergies, and even drugs. You hear a lot of things about reactions to beta blockers, right? Because beta blockers are bronchoconstrictors, okay? So all this stuff can contribute to a patient having an asthma attack or having a COPD episode, okay? So again, before I get in, I want to talk a little bit, focus this session on asthma, but I want to kind of go over the broader overview of both COPD and asthma. That's why I talked about the contributing factors, but I want to talk a little bit now, go over some of the pathophysiology of it as well, okay? And when we talk about that, what we have with the obstructive lung disease is that smooth muscle, right? And what's happening is it's spasming. You're getting that bronchospasm, okay? And you get mucus buildup, okay, with the cilia that can move the mucus out. It's not really working that well because of inflammation, okay? And again, beta blockers, which can actually go ahead and constrict that smooth muscle, right? So that's why we give those muscle relaxers for asthma and for COPD, the Preventol, the albuterol, the aminophylline, okay? All that stuff is what we're using, okay, to smooth out those the muscles and to relax and bronchodilate instead of bronchoconstrict, which beta blockers can do, okay? So like I said, I want to talk a little bit more on asthma, kind of focus it on this episode on that. And asthma, like I mentioned earlier, it's got that 9 million somewhat people that are affected by it, okay? And it's hypersensitive. It's the hypersensitivity to the bronchial airways, okay? And those can be very easily irritated. You get the bronchial spasm. It can limit movement of air. Again, the mucus will build up. You get that swelling, you get that edema, okay? And you can get inflammatory cell proliferation, meaning it's starting to go every place, right? And it's also important to note something that they call status asthmaticus as well. And this is that severe prolonged asthma attack that patients can get that does not respond well to their normal rescue inhalers. Okay, it's hard even for you to get them to respond to a basic albuterol or Convivent sort of treatment. Okay, so these patients you're going to want to treat aggressively. You're going to want to monitor their airways, monitor the lung sounds. Okay, we have things like CPAP nowadays to treat that. We'll go into treatment in another episode, but that's sort of the basics on asthma. Now, I want to talk about some of the triggers for both asthma and COPD, okay? And we talk about triggers. We're talking about things like respiratory infections. Again, I mentioned allergens earlier and drugs as well, right? Some allergens, again, the animal dander or drugs like beta blockers, stress, other irritants that are out there, environmental sort of irritants. Exercise can trigger an attack as well. Okay, chemicals, and again, even and the changes in the environment, cold air, warm air, sudden changes in the temperature can trigger something as well. Okay, so guys, this is just the beginning of the obstructed airway segment. Again, I want to focus a little bit more on asthma and then give you sort of a broader overview of some of the triggers and the pathophysiology of it and all that. Next time, we're going to talk more about um, COPD. We're going to get into that. We'll get some signs and symptoms of what we're looking at when we talk about asthma and COPD, and we're going to also probably go into some of the management as well, right? That treatment as well. So these episodes are a little bit longer, okay, because there's a little more in depth when it comes to respiratory issues. But I'm trying to break it down so it doesn't get too big and too hard to absorb this content, okay? Guys, remember, you can engage with me on social media. I encourage you to do that. I'm on Twitter and Instagram. Both of those, I'm at EMS Safe. And also on Facebook. It's facebook.com/the EMS Professional. Guys, don't forget, you can get more study help and exam help and ways to increase your knowledge base by going to the main website at emsseo.com. Lots of free and low-cost resources for you there. And again, go ahead and contact me, guys. My email, it's contact@emsofficehours.com. I'd love to hear what you have for your Monday Minutes and what you think about these episodes. Send me your thoughts there. You can even leave it in the comments below as well. All right, guys, that's it for me. As always, Jim Hoffman for EMS Office Hours and the Monday Minutes.